Welcome to the bullshit-free zone. Welcome to Weight Loss Biohacks. In this video, we will explain what you can do if GLP-1 drugs such as Ozempic, Wegovy, Rybelsus, and others all of a sudden stop working for you. More specifically, we will cover the following topics: how GLP-1 agonists may suddenly stop working, why the loss of effect occurs, how can you determine if it's something to do with the drug or if it's something to do with you, what can we do preemptively to either completely prevent this from happening or at the very least delay such loss of efficacy? If the loss of efficacy does indeed occur, should you up the dose or should you switch to another drug? If you decide to switch to another drug, which drug should you switch to? And finally, does it make sense to take a break from the drug to regain sensitivity? Now, in the previous video, we have explained everything that you need to do about GLP-1 agonists. Please watch that video, even if you're already on GLP-1s and may think that since you're utilizing the drug already and have pretty much come to the end of your cycle, there isn't much to know. There indeed is. I absolutely urge you to watch that video because it contains important pieces of information. Here, I'm going to very briefly recap what we have spoken about in that video, taking no more than a minute of your time. Basically, GLP-1 agonists are the most powerful weight loss tool we have at our disposal. They have a far better safety and tolerability profile than anything else, comparably powerful. They are, however, pretty expensive, so we definitely want to learn as much as we can and make the most out of the experience. The ones that are worth taking for weight loss are tirzepatide, semaglutide, the oral version of semaglutide, and liraglutide, the brand names given in parentheses. Unfortunately, sometimes this happens. They all of a sudden stop working, and it absolutely sucks. Let's go to Reddit and speak about some of the experiences of users. For example, one person says, I lost 30 pounds, had all of the side effects, then one day it suddenly stopped working, my hunger is back and I'm eating so much, anyone else. And this, when it does happen, tends to happen all of a sudden, causing great confusion and sometimes even denial, because you cannot believe that something that worked maybe a week ago all of a sudden stopped working so suddenly. Somebody else says, I'm a couple of months on 1.7 and it stopped working. Gained a half pound back each week this last 2 weeks. Food noise is back, hunger is back, snack appetite is back. Not sure if I should go higher. Might try injection site change. I do seem to fill up faster still, but I miss when food was an afterthought. Beautifully summarized. Look at all the things that came back for this person. He or she says food noise came back, hunger came back, and snack appetite came back. Absolutely beautifully expressed. Somebody else says, yeah, I fill up faster as well, but the old habits of overeating and wanting to just eat to eat are coming back. It's really weird. It is weird indeed, yeah. One other person says, so I was taking Saxenda for a few months, and the effects definitely started to wane. And finally, at the bottom, this poster says, I started Saxenda mid-August last year. First 6 months were great. I lost 55 pounds. After that, nothing. My weight is now stable, but I'm not even halfway to my goal weight. I've tried to take a week off and start again. I've tried to go back to lower dose. I've tried to change where I inject. No response. Food noise in my head is back, and so is the evening cravings. Pretty unfortunate when that happens. By the way, people here are talking about changing injection site. For example, if you're injecting on the side of your midsection, you should, the next time you inject, try the opposite side. If you're injecting right into your belly, you should go up an inch or down an inch next time. You definitely should rotate injection sites with anything anyway. If you happen to have not rotated injection sites and suddenly start doing that, could that actually help the drug all of a sudden start working again? I doubt it. But always worth a try. Now, a few takeaways from what we have read. One day, this drug may totally stop working. Do not panic. This does indeed happen to people. Some people wonder if they got a fake drug, even though they got it from a pharmacy. Some people wonder if it's something in their head, and we'll come to that in a minute. Even if you do everything right, the drug may one day totally stop working. And when it happens, it tends to happen suddenly. But then again, it also may happen gradually. No way to predict it. So be prepared for everything. If the loss of potency occurs gradually, problems can creep up on you. Snacks and large portions may slowly come back, and by the time you notice, you may already have put back a couple pounds. Once again, there is no way to predict if the loss of efficacy will happen, when it happened, and in exactly what fashion it will happen. Whatever is happening to you, chances are it's not something you're imagining, chances are it's actually happening. Another complicating factor is how much weight you lost. The more weight you lose, of course, the more difficult it gets to lose additional weight. This happens because of a number of reasons. I don't want to reduce it to one single biochemical, but possibly one very important player in this whole game is leptin. Leptin is secreted by your fat cells, and the more fat tissue you have, the more leptin you secrete, and the more full you feel. Leptin makes you eat less, reduces hunger, and as the amount of fat in your body decreases, the amount of leptin secreted decreases. Again, there's a whole lot more going on in the background, but leptin is a major player, and consequently, as you have less and less fat to lose, it does indeed become harder and harder to stick to a diet. By the way, here's something very, very interesting that most doctors do not know. We do know that eating behavior is very much tied to your emotions, and emotional eating is very difficult to overcome. In this particular research, published recently in the Psychoneuroendocrinology Journal, they make the following remarks. They say GLP-1 agonists induce weight loss by direct and indirect actions on the brain. There is considerable variation in individual responses to GLP-1 receptor agonists. And finally, they point out the following. We found that emotional and external eating were associated with less liraglutide-induced changes in brain responses. So what they basically are trying to say is if your eating is more emotional in nature, GLP-1 agonists will work much less well. And I have absolutely observed this with my clients. Totally. So if all of a sudden a GLP-1 agonist drug stops working for you, ask yourself the following question. Are you going through a hard time? Did you maybe revert back to emotional eating? Chances are you did have that before. This is probably not the very first time this is happening to you. Have you reverted back to the emotional eating patterns that you had back in the day? If you did, the drug will continue to work on the gastrointestinal system, but it will not work nearly as well in the brain. One little clue that may provide, a hint that your eating is more emotional in nature is the following. If all of a sudden you feel a rush of anxiety coming and immediately seek food thereafter, this is a sign that your eating is more emotional in nature. You're going through your day, things appear normal for no good reason at all, or maybe because of a specific reason, you have a rush of anxiety, and soon thereafter you have a rush of appetite, desire for food. If this is the pattern that your eating tends to follow, if this is the snacking habit, this describes your snacking habit, then chances are your eating is more emotional in nature. What can you do preemptively? What can you do in order to delay the loss of efficacy of the drug for as long as possible? Number one, follow the golden rule of pharmacology. The best dose of a drug is the lowest effective dose. Do not seek the highest dose that you can get away with. Seek the lowest dose that will get the job done. Look for additional ways to get away with less. Implement other biohacks to stave off hunger. Not other drugs, but other biohacks to stave off hunger. Work on your meal timing. Try to have as much protein as you possibly can. Stay away from triggers that may lead to binging. By the way, occasional use of GLP-1 agonists is absolutely an option. As we spoke about in the last video, if you're taking the oral pill, the Rybelsus, you might, for example, realize that taking it 5 days a week is exactly as effective as taking it 7 days a week. If so, do it. Absolutely. You will not only make the drug last longer, but you will also desensitize to the effects of the drug over a longer period of time. By reserving with a lower dose, of course, you reserve the option to up the dose or frequency as the drug loses potency. And of course, as we said in the last video, once again, worth repeating here, do not adopt bad habits while on GLP-1 agonists. This is also very, very important because when you do these things and the drug is working as powerfully, as potently as it can, then you can get away with these things. But as the drug loses some of its effect, these things will come back to haunt you. As we said, And also, by the way, especially if you really reduce your protein intake, you will lose muscle. And when the drug stops working, you'll find yourself in a terrible place. You will feel weaker while also having a slightly, not tremendously, but slightly slower metabolism. What not to do? As we said, do not increase your consumption of junk. Do not stuff your fridge with junk. Do not skip the protein while taking GLP-1 agonists, even if it does appear that you can get away with doing so. And do not stop cooking at home. Now, should you increase the dose? This part is important. It's an easy thing to do. You can always inject a little bit more, or you can maybe, if you're taking the pill, just once try 1.5 pills. Or if you've been taking the pill 5 days a week, you can go up to 7 days a week without skipping a day. It may work, but there's also a good chance that increasing the dose will do absolutely nothing. Do not be surprised if you find that this is happening. You may double the dose and see absolutely no incremental effect. Why that happens is a very lengthy discussion, and that lengthy discussion is going to basically involve mostly speculation. This is a phenomenon that I've seen with many, many drugs over the years. And I've actually had deep conversations with some experts in ligand chemistry. These are people who specialize on the receptors in the body, how they work, how they get sensitized or desensitized over a period of time. We do not have a full and complete answer. Bottom line is, if you up the dose and you don't get any incremental effect, do realize that this can happen. This does happen to people. Do not insist on the higher dose for too long. You'll waste money, you'll waste time, and most importantly, you will further and more deeply desensitize your body to the drug. At that point, switching drugs may be an option. So let's take a look at that. Is a switch worth it? Yes, it is. Provided that you go down the list, provided that you switch from the right drug to the right drug, you do the right switch. If you go down this list, it's worth it. So if you've been using liraglutide, it makes sense to try either semaglutide or tirzepatide. If you've been using semaglutide, either form of semaglutide, it makes sense to go to tirzepatide. But you don't want to go up this list. If you've been using semaglutide, switching to liraglutide will almost certainly not do anything at all. And if you've been using tirzepatide, switching to anything else will likely not do anything at all. Of course, this means that if at all possible, you should not start with tirzepatide, even if you have access to it. Because if you do, and it stops working, you got nothing stronger to go to. And finally, how about taking a break? Will that work? Chances are, yes, it will, to an extent. Now, we can only speculate. This is the only bit of information that we can use in order to arrive at some preliminary conclusions, but we do not have exact data. What is this research that you're seeing on the screen? This is from the European Medicine Agency information sheet. Now, a while ago, when a whole bunch of us were nerding out about this stuff, when some professionals as well as enthusiasts were getting into very deep discussions as to what exactly happens when these drugs stop working, some people brought up the idea that you may be building up antibodies to the drug, i.e., your body might be attacking the drug. Your body might be developing a system where it's treating this as like an invading virus, and the immune system of your body gets on high alert. And every time you inject the drug, before the drug has a chance to go ahead and do its job, the body's defensive mechanism is attacking and destroying the drug. This is what building antibodies to something means in layman's terms. And somebody brought up the point that this is what's happening, and this is why the drug does not work after a while. And when that happens, taking a break, the person said, the people behind this idea said, will not be effective because antibodies linger in the body for a very long time. It took me a long, long time to actually go ahead and find this piece of information. I also posted it in those discussions, and the community was very receptive to it. Basically, this happens very, very rarely. The percentage of people who at some point develop an antibody to the drug, to semaglutide specifically, is 1 to 3%. But more importantly, at the end of the trial, those antibodies seem to go away. When you follow up people and measure their blood concentration level of this particular antibody, at the end of the trial, pretty much nobody had those antibodies. Good news. So it doesn't look very bleak. The loss of efficacy is probably or almost certainly not the result of your body developing antibodies to it. So there's a chance you may get resensitized after a period of time. How long a break should you need? Absolutely no idea. We can only speculate because no research has looked into this. Now, let's get the bad news out of the way first. There's a good chance that it will never feel as strong as it did the first time. This is true for many drugs, and once again, something we can nerd out and get into a deep discussion about for hours and hours, but we will not be able to provide a perfect answer because nobody knows why. Some people even completely deny the existence of this phenomenon. What I'm talking about is the following. You take a drug, let's say the doctor prescribes you Xanax for your anxiety. You take it, the very first time you take it, it works so unbelievably well that you believe this will solve every one of your problems in life. You're absolutely loving it. After some time, it either loses efficacy and you stop, or you stop because you no longer need it. You take a very long break. Let's say, for argument's sake, you do not take it for 2 years. And then you go to the same doctor, get prescribed the same medicine, same dose. You obtain it from the same pharmacy, it's made by the same pharmaceutical manufacturer. You haven't taken it for 2 years, you haven't taken something similar for 2 years. You should absolutely be resensitized to the drug. You take it, yes, it works, but nothing like the first time. This happens all the time with so many drugs. I speculate, again, I underline the word speculate, that this will also happen with GLP-1 agonists. They may never work as strongly as they did the first time. However, taking a break might get you resensitized to it to an extent. A very short break will likely do nothing. So if all you're going to do is, skip one weekly injection, you may as well, not do that at all. I mean, it's just going to result in disappointment. A month off is perhaps a good starting point. This is entirely speculation on my part. Again, nobody has looked into it. You know what? I take that back. This is not entirely speculation on my part. This was entirely speculation on my part. A number of people that I correspond with have actually tried it, and they seem to actually get a greater effect after a month off. So this is my speculation, and upon which we have built maybe a little bit of real life anecdotes, real life data, not even data, real life observations that at this point are too few and far in between. It is still a speculation, but there's a bit of a meat behind it. Let's put it that way. During the break, all you want to do is maintain your weight. If you can manage not to gain any weight during the break, that is good enough. Do not expect to lose weight at the same pace as before while you're off the drug. If you do, you're setting yourself up for a major disappointment. Maintaining your weight is more than enough. Of course, during your break, utilize any other biohack that has in the past worked for you. It can be nicotine, it can be other pharmaceuticals. Absolutely keep your protein intake high. Involve the other smart diet hacks that we have and will talk about in this video series. Of course, needless to say, you now have much less room for error. Be careful while eating out. Absolutely do not keep any junk in your refrigerator. The risk of a binge is also very much elevated. See a binge coming. We'll make a video about that shortly. And do take the appropriate precautions as a binge is approaching. Of course, one last point. If during the break you will be utilizing other pharmaceuticals, that means do not use other pharmaceuticals while on GLP-1 agonists. If, for example, you are using nicotine and Wellbutrin and GLP-1 agonists all at the same time, when taking a break from GLP-1 agonists, you have nothing to add. You have nothing new to bring to the table. So do not throw the kitchen sink. When on GLP-1 agonists, do not use other pharmaceuticals. I understand the temptation. You're probably thinking, let me just hit this on the head with a sledgehammer. Let me get rid of this excess weight once and for all. Let me throw in everything in there. Do not. It's because of the simple reason that when you take a break from GLP-1 agonists or must, for whatever reason, completely stop using them, then you will have nothing new to fall back on. Okay, so where do we stand right now? Thus far, we have covered two powerful tools. We have spoken about nicotine, We have spoken about GLP-1 agonists and also covered in this video what to do when they stop working. We said we will come back to the basics such as diet and exercise later on, and that time is now. Let's go back, cover some fundamentals. In the next video, let's address a very simple yet very fundamental question. How does the human body burn body fat? Does it all really just come down to the calories? We got to resolve that once and for all. So see you in the next video. Thank you.